Hi everybody and welcome back to Rebellious Menstruation. Today's Q&A will be on hormonal contraceptives such as the pill, patch, implant, vaginal ring and injection. The pill, otherwise known as hormonal birth control or HBC, has been available for women since 1961 in the current types of formats. Essentially, all of these contain small amounts of man-made estrogen and progestin, which work to inhibit the female body. The female body's natural cyclical hormonal cycle, because as you well know, your period is not just the time that you bleed. Your cycle goes for anywhere between 21 to 35 days, depending on your own personal hormone cycle, and it involves, the lead up to ovulation, the down cycle from ovulation, and your, bleeding period. So it entails the whole thing, and this is where hormonal contraceptives come in to essentially take out two of those things. They are primarily used to prevent unplanned pregnancy, as they're usually, or their main goal is to prevent the body from ovulating. They're really effective at doing this generally, and nearly all of them rest above the 99th percentile in preventing unplanned pregnancies. The consequence of taking the pill or hormonal birth control is that any period or bleed while on contraceptives is a drug withdrawal bleed. It is not an actual period and is unnecessary. It's one of the myths possibly we'll be dealing with in a myths video. However, it's not necessary to empty out your uterus or anything, because your uterus is not retaining the blood for a potential pregnancy, which is really what the period is. It's like cleaning out the home when a pregnancy does not turn up. So if you're preventing the ovulation, you're preventing the retention. So really it's like a drug withdrawal. There are predominantly two types of the female oral contraceptive available in Australia, which is the countries I am in, the combined pill and the mini pill. They both work similarly, the same, by stopping the ovaries from releasing an egg and thickening the fluid around the cervix to prevent the sperm from entering. So kind of almost like a preventative spermicide. The alleged benefits that are related to the pill are skipping your period altogether, regulating and lightening your period. But as I just mentioned before, it is not a real period and is not really regulating your natural hormonal period. While reducing pain, acne, and also assisting with the polycystic ovary syndrome, otherwise known as PCOS, and endometritis and andrometritis. This is generally a lie, however, as the pill does A, not give you a period, it B, suppresses your hormonal cycle and your natural hormonal cycle that you have by not allowing your body to ovulate. It masks serious illnesses like PCOS, endometritis and endometritis, and as well as having very serious side effects like irregular bleeding, nausea, tender breasts, headaches, bloating, skin, mood changes, and increasing risk of high blood pressure, deep vein thrombosis, otherwise known as blood clots, heart attacks and or strokes, and is associated with depression, decreased libido, decreased risk of fertility, and an increase in cervical, liver and breast cancer. So there are a lot of negatives to actually having this, to taking the pill, more than there is positives. I'll go over the alternatives to the pill at a later date, or well, later on in the video. There might be a part 2 to this video, depending on how long this takes. However, with the decreased fertility, the longer that you're on the pill, you have to kind of waylay that against the fact that there's a decreased fertility with age as well. So, you know, if you're on the pill between 20 and 30 and come off and have fertility issues, you could just have natural fertility issues, or B, after 30 your fertility is actually going to drop anyway, so or your access to fertility decreases. So it's kind of a little bit of a hard path to kind of go down. It's not going to, but just there's not enough research essentially into differentiating your fertility that's been hampered by the pill and your fertility that is associated with your age. So that kind of leads into the fact that there was little research into certain things like the cancer link. They believe that there is a cancer link to breast cancer and liver cancer. However, because they haven't really looked into it, because women's health doesn't matter, thanks patriarchy, that there's not enough substantive evidence as to which hormone, progestin or estrogen, which causes cancer. So they've created a causal link, but they haven't gone down in depth into which hormones actually causing this type of cancer. You know, because the medical establishment doesn't care about women's bodies. Thanks patriarchy. There are alternatives specifically to the pill. These include IUDs, which are intrauterine devices, which are small T-shaped coils inserted into the uterus. There are 2 varieties of this, non-hormonal. These work to disrupt the sperm's mobility and actually damage the sperm to prevent it from reaching the egg. Also some of the copper coils, there are several different types, but there are copper coils, and these act as a natural spermicide by increasing the use of copper ions, prostaglandins, and white blood cells within the uterus, and other certain fluids that are present in your uterus. The advantage of this is that they are non-hormonal, so can be used while breastfeeding and travelling, and are available in a wide range of sizes and shapes. The disadvantages include possible heavy periods, increased cramps, and a perforated uterus. So, there are also, obviously, the second one from this is hormonal IUDs, which work by releasing levonorgestrel, progestin into the body. There are several size variants, along with the amount of levonorgestrel released into your body and the duration that it's released into your body. The primary mechanism is making the uterus uninhabitable or hostile for sperm. The thing that they can thicken the uterine lining. However, this can also reduce and prevent menstrual bleeding, so therefore they have actually had a side effect of being used to treat menorrhagia, which is heavy menses. IUDs act as a localized hormonal control rather than your whole body. I mean, everything's connected anyway, but it's considered localized because it's in uterus. They can be used up to 5 years and are made of stainless steel, plastic, and copper, and come in another variety of makes. The side effects for both the hormonal and the non-hormonal are both change bleeding patterns. They can be expelled, causing damage to the cervix. They can cause pelvic inflammatory diseases and uterine perforation. the exceptionally small risk of pregnancies, because obviously practically nothing is infallible, will generally result in an ectopic pregnancy, which is where the embryo attaches outside or away from the uterus. So kind of in the, 0.5% chance that you may end up pregnant, that pregnancy is very likely to be ectopic. And the other one is Depo-Provera, which is an injection that releases hormonal progestin into your bloodstream to prevent pregnancy. This lasts approximately 12 weeks or 3 months and is classified as a non-invasive hormonal measure. This has side effects of irregular periods and bleeding, as well as a complete stop in menstruation, altogether from continual use, even when you've come off it. Long-term use can reduce the mineral content of bone and is therefore not recommended for people under 25 or over 45. It can also affect your long-term fertility by up to 24 months. Other side effects include migraines, abdominal pain, irregular bleeding, vaginal discharge, breast pain, mood and libido changes, as well as mentioned before, permanent bone damage. There is also a transdermal patch, which is worn under the skin, and there's also patches that you wear on the skin. You can put on your arm, stomach, butt and back for up to 3 weeks, releasing hormones into you that way. The side effects include all the usual suspects, like migraines, anxiety, bleeding, discharge, breast pain, mood and libido reduction. However, also has the added bonus of darkening of the facial skin and hair, skin irritation and dermatitis, particularly where the location of where it is on your body. It is a combination of, the transdermal patch is a combination of estrogen and progesterone. Okay, so there are options for men, so traditionally male birth control options were of the disastrous pull-out method. So that one doesn't work, we already know that. So the pull-out method and the rhythm method, we're going to discard them straight away because they're pointless. And also vasectomies and condoms, essentially. These options are culturally unpopular because, well, we know the pull-out method doesn't work very well, but they also don't like culturally unpopular being condoms because they're ineffective if used improperly or easily exposed to incompetent wearing or putting on, or they might come off or break, or they're viewed as permanent like vasectomies. So men, particularly in most cultures around the world, do not want a vasectomy and do not want to take away that possibility of what? No, I don't know. But yeah, so they're culturally unpopular for a variety of social reasons, or for being ineffective. The focus of hormonal birth control for men has been, the focus of hormonal birth control has been specifically on women and utilising their bodies as essentially a live lab testing rather than men. This is another one of those thanks patriarchy moments. Recent studies over the last 10 to 15 years towards male contraception have been either a pill or an injection, and as recently as 2016 have found to be effective at preventing pregnancy, as effective at preventing pregnancy as female pills and injections. However, these studies have mostly been drawn short or cut short due to adverse side effects in male subjects. The subjects involved also voluntarily withdrew due to self-described severe side effects such as headaches, mood issues and libido issues. Essentially, they had far less effects than women and far less physical consequences than women on the pill. However, they didn't like any of the consequences, so they chose not to continue. This is one of those severely frustrating things, and I am trying not to scream or rant about it right now, because it's extremely frustrating to me that women have had to be putting up with this type of stuff since 1961. In a trial for men, they pulled out because they suffered less consequences than women currently do. There are two main issues with the delay in contraceptives for men. Is basically the attitude to men in taking contraceptives at all, which of course is ultra ironic considering the same aversion to males using any such birth control, such as condoms and vasectomies. It's almost as if the patriarchy holds up all the power and none of it wants all the power, none of the responsibility. The second reason is that female contraceptive pills are very successful. And have been very successful at preventing pregnancy. So there is little incentive to invest in a male pill when the female pill has an approximate market value worldwide of about 20 billion. 2018 has seen the development of an injection and a gel. And this gel requires the man to receive a massage because it's applied to his lower back. And quite frankly, this rages my brain. It enrages my brain that they refused the pill because it gave them headaches, yet now have invented a gel that is required to be massaged on. It is so sexist and degrading. Massages in an intimate situation, perfectly fine, but the fact that they've set it up this way is just so disgusting. There is also theoretical products that are currently in the animals testing stage, such as the clean sheet pill, which prevents the release of active spermidol, and the Vasal gel, which is a non-permanent vasectomy and is currently the only form of contraception for anybody at all that is rated at 100% effective, whereas kind of everything else is rated in the 99th percentile and above. So that kind of leads me to another very important point, in case you didn't realise, is that it's very important to realise that the pill in any form is not vegan nor animal friendly. They've all 100% been tested on animals, and most contain milk, lactose and animal-derived products. Historically, one of the pill's ingredients was Premarin, which was made from dehydrated horse urine. There are also severe environmental consequences to taking the pill, as all of these hormones are excreted in women's urine and into the water and are affecting our environment and marine life. So the last thing I'd probably like to point out is that I'm kind of surprised I got through so much information at once, to be honest, is that there is a natural product at the moment called a Daysy, Daysy. I'll link the website below. It is promoted as a complete fertility management system, and is a fertility monitor of your daily fertility status based on the regular measurement of your body's basal body temperature. So you take your temperature daily, it takes about 30 seconds, and it's recorded in an app. Daisy uses a statistical program to estimate the fertile and non-fertile days, which are colour-coded. It is a certified medical device. And while I personally haven't tried it or used it, it doesn't actually medically suppress your normal or natural cycle, and can be used as both a pregnancy avoidance or a trying to get pregnant, because it records all of your fertile and non-fertile days. So again, I'll link them below so you can check it out. And while I personally can't attest to the how good or bad it has been that I haven't used it, all of the people that I've seen who do use it rave about it and love it. And it is, when used of course properly, just as effective as anything else. Thanks for hanging out with me all this time, and other than that, enjoy the rest of your day. Bye.